The next speaker, I got to tell you a story about myself. I refer all my hearts to Mayo Clinic in Rochester to Dr. Connolly. Yet I had never met Dr. Connolly till this morning. We've talked on the phone. My patients love her, and she has kept my patients who have bad valves going for years on end. So it is a real pleasure, personally as well as professionally, to introduce you to the Queen of Hearts, Dr. Heidi Connolly.
Thank you so much. It's a great pleasure for me to be here today and to speak to you on a topic that's near and dear to my heart. And thank you for that kind introduction. We're going to talk about how neuroendocrine tumors affect the heart. And actually, just to start, I'm going to talk about how the heart works, because I deal with it every day, but I'm sure many of you do not know exactly how it works. We're going to talk about how carcinoid can affect the heart, recommendations for screening, how to prevent carcinoid heart disease. That's a big question mark, but we'll talk about that as well. Treatment of carcinoid heart disease. And then just at the very end, I'm going to touch on the fact that some of the newer agents can also cause heart disease that's a little bit different than what we're going to be focusing on today. Can you all hear me okay? Okay, great. So let's look at the normal heart. How does the heart work? The heart is a muscular pump. It consists of 4 chambers and 4 valves. The area, the blood flow from the veins in your body carry the blue blood or deoxygenated blood. That blood goes back to the chambers on the right side. Top chamber first, then through a valve into the bottom chamber, and then as that chamber pumps, the blood is pumped out to the lungs, and in the lungs, the oxygen is picked up, and then the oxygenated or red blood returns to the left side of the heart. Now, importantly, in individuals who have carcinoid, the valve involvement affects the right side of the heart primarily, rather than the left side of the heart. And we think that that's related to the fact that the serotonin, which causes valve disease, is somehow denatured in the lungs. So it's filtered by the lungs, and left-sided valve disease is generally not seen in carcinoid. Now, in other individuals with valve disease, by far the most common type of valve disease we see is disease affecting the left side of the heart. So you are unique for lots of different reasons. So again, normal function of the heart demonstrated here. The function of the valves is to try to prevent blood to flow in the wrong direction, just like a car valve, etc. And let's look then at what happens when carcinoid affects the heart. Now, we've heard about the active substances that are produced by the carcinoid tumors, one of which we think is most important is serotonin. It's been demonstrated that that does have a role, plays an important role in the development of heart valve disease. We know that up to 50% of individuals who have carcinoid type of tumors will ultimately develop valve disease. And so how does this occur? Going back to our movie here, we're going to look at this, the heart. You can see there are some metastases in the liver in this particular movie. And then there are the active substances that come from the primary tumor and from the metastases that then affect the valve. So let's look at how this works. You can see that active material in the venous blood that's going into the right side of the heart. Thickening of the valves occurs, and there's some thickening also of the lining of the right side of the heart. You can see that the 2 valves are affected, the tricuspid valve and the pulmonary valve, but that the left-sided valves are not. And what happens ultimately is that the valves do not close or open completely normally. As demonstrated here by the arrows, there's backflow, or what we call regurgitation of blood, into the areas where it should not be. So backflow is the primary problem, or regurgitation, related to thickening of the valve disease. Thickening related to the valve disease. Now this is a picture of an explanted valve, a tricuspid valve removed at the time of surgery. It's 5 to 10 times thicker than what we would see in a normal valve. And what happens is that there's cellular material, some plaque formation that forms on the valve and prevents it from moving normally, and importantly, prevents it from closing normally. So again, that causes severe leakage of the valves. Again, just to emphasize, we think that, of course, there are a number of active substances that are produced by carcinoid tumors, but really serotonin appears to be the key player here. So there has been research to identify that there are receptors on the valves, special serotonin receptors that are activated by serotonin and that cause that thickening and quite unique type of valve disease. So what about features of carcinoid heart disease? You can have valve disease without having a lot of symptoms, and there might be a time where no symptoms are present despite the presence of very severe valve disease that we can identify by testing. But ultimately, symptoms do occur, and they include breathlessness and fatigue, pretty nonspecific symptoms that all of us have from day to day. So it can be quite difficult to determine whether those symptoms are indeed from the heart. Other problems include fluid accumulation in the lungs and in the abdomen, so-called edema and ascites. And indeed, although these can be from heart valve disease, they can also be from liver disease, nutritional problems, or a combination of multiple or several of these entities. So although the symptoms can be quite dramatic, it's sometimes difficult to differentiate, is this symptoms from the valve disease or is it actually from something else? So what about screening individuals who are affected by carcinoid type of tumors for heart disease? What's recommended? Well, the North American and European neuroendocrine tumor societies have made recommendations. Of course, we want to identify the type of tumor first, as has been elegantly described by previous speakers. Evaluate the patient, look for symptoms or physical examination findings that suggest the presence of cardiac disease. Now, there's a type of blood test that can be ordered and checked. It's what we call N-terminal proBNP or NT-proBNP. It's been demonstrated in several studies to be elevated in individuals who have carcinoid heart disease as compared to carcinoid patients who do not have valve disease. So it's an opportunity to do some just basic blood work to identify those who might be at risk. But it must be emphasized that this blood test, it is a hormone-like material that can be abnormal for other reasons. Heart dysfunction not related to carcinoid, and indeed kidney dysfunction and other disorders. So really the gold standard for the diagnosis of carcinoid heart disease is an echocardiogram or a cardiac ultrasound. And let's just take a moment to look at what an echocardiogram is. In an echocardiogram, a probe, an ultrasound probe, is put on the chest wall. Ultrasound waves are passed through the tissue in the chest wall and then reflected back to the probe, where we can look at the heart and how it functions. And here are some examples of the pictures that we get. And it's really a matter of pattern recognition. By doing this every day, we know what looks normal and what doesn't look normal. So interestingly, and I think importantly, is the fact that we can actually see the tricuspid valve very well. As we rotate, as demonstrated in this image here, over to the right side, that's the tricuspid valve there. A normally functioning tricuspid valve is delicate, but yet very practical in that it prevents backflow of blood. We can also see the pulmonary valve well as we angle the transducer up to the left shoulder. And here's a normal pulmonary valve, which is nicely demonstrated on this echocardiogram, again, cardiac ultrasound test. So an echocardiogram is very helpful in individuals who have symptoms of heart valve disease, and indeed some have recommended that it be done at baseline in all individuals, just to confirm that the heart is normal at the time of initial evaluation. So what are the things that we look for on an echocardiogram? As a cardiologist, I can't give a talk without showing you some echo pictures, so please bear with me. So this is a heart that's affected by carcinoid, and we'll look at some moving pictures shortly. This is the tricuspid valve, and it's thickened and fixed in an open position. That's a characteristic feature, and we teach all of our fellows that if you see that, the first three things that you should think about are carcinoid, particularly if the patient is seeing me. Leakage is very common. This is what we call color flow Doppler, and demonstrates backflow of blood. The color doesn't really matter so much. It just demonstrates to us that there is blood flowing in the wrong direction. So on a scale of 0 to 4, this is a grade 5 degree of leakage of blood. So leakage or regurgitation is very common in patients with carcinoid. Again, the pulmonary valve gets a bad reputation by echocardiography. They say it's very difficult to see. In fact, we can see it in most circumstances or see the effects by using a particular Doppler technique here that we call continuous wave Doppler. Other things that we want to look for are the size and function of the right heart, whether there's evidence of left-sided valve disease, which occurs in about 10% of affected individuals, and then whether there's a metastasis in the heart. That is pretty uncommon, but we can see it by echocardiography. And then occasionally either a hole in the heart or fluid around the heart can also occasionally be seen. So here's an affected individual. This is looking at the right heart. There's the tricuspid valve, and there's that severe leakage of the tricuspid valve. In fact, about 5% of patients that we see at Mayo have the initial diagnosis of carcinoid identified by this very typical appearance noted on an echocardiogram. So it's so unique that we can really make the diagnosis by the echocardiogram. And then the pulmonary valve, again, I can't not show you this beautiful example of a very thickened pulmonary valve and then the regurgitation that goes along with that. So tricuspid valve is essentially always affected, pulmonary valve in about 2/3 of individuals with the carcinoid valve disease. You might ask yourself, well, I get a CT scan or MRI all the time to look at my liver disease. Can't you do that for my heart as well? Well, we can, and we can actually identify valve disease, but we really use it as an extra tool to get some additional information if the echocardiogram hasn't provided the information that we need. So reports have demonstrated that they're very helpful for particular entities. Look at the right heart size and function, look at the pulmonary valve if we can't see it well. And this is a CAT scan in an individual with carcinoid heart disease, and this is the tricuspid valve, which is thickened and abnormal, and the pulmonary valve is demonstrated here, also thickened and abnormal in this individual. So the big question, I think the burning question today is, how do we prevent carcinoid heart disease? I wish I had the answer. I do not. But really the talks that we've already heard, I think are key to the answer of how to prevent carcinoid heart disease. It's very aggressive identification or early identification of the tumor, aggressive treatment of the tumor and its activity, try to decrease the level of circulating serotonin as much as possible, removal and reduction of as many of the metastases as absolutely possible. Now, a lot of patients will ask me, have you ever seen the valve disease get less? And in fact, I have not. Despite very aggressive therapy, I've never seen valve disease that's present get better. So regression has not yet been identified, but that doesn't mean that we shouldn't look out for that in the future. So something to look at in the future. How do we treat carcinoid heart disease? Well, just like Dr. Woltering said, surgery, surgery, surgery. That's really the treatment of choice, although we do have some medical options. Now, I think it's important to say that we do watch patients until they do develop symptoms in the majority of cases. Once they develop symptoms, it's generally fluid accumulation, so we might try diuretic therapy, and that's a water pill to decrease the amount of fluid. Unfortunately, that sometimes will make patients more fatigued because it decreases the effective output of the heart as well. So really, limited medical options are available. And surgery with valve replacement, unfortunately not quite as easy as I've demonstrated in this schematic, is the treatment of choice. Unfortunately, again, it's a big procedure. It requires the patient's heart to be stopped, and the patient is put on a bypass machine in order to replace one or both of the right-sided valves. Indications for operation. Again, I've alluded to symptoms, number one and most important, and we look really to try to identify, are these symptoms from the heart? Number two, right heart enlargement or dysfunction. That is very uncommon without symptoms, but can occasionally occur. And then if you have a tumor that's amenable to liver surgery and aggressive intervention from an operation standpoint, the surgeon will not want to do that liver surgery until we've taken care of the heart valve. So prior to liver surgery is another indication. If the pulmonary valve is affected, we always replace it now. That's something that we've learned with time. And just like other series, we've gotten better at this. Our initial experience, the surgical mortality was actually pretty high, 25 to 30%. But now with over 200 cases of patients with carcinoid valve surgery done at Mayo Clinic, the mortality is between 3 and 5%. So really dramatic improvement in survival. And that's because of the multidisciplinary team approach, pre-treatment as has been discussed, and then aggressive therapy in the operating room and in the post-operative period. So we always want to balance the opportunity of operation with observation because we don't have a perfect procedure and because the valve options that we have also are not perfect. And there are potential problems that we can discuss later on with regard to that. We also want to emphasize that patients will be better after valve surgery, and the majority of the time that is the case, but there are some exceptions. We published a number of years ago that over 2 decades experience, we've demonstrated that patient survival has improved, those patients who have cardiac involvement, and the primary reason appears to be the aggressive approach to cardiac valve replacement. So patients ask me, can I do everything I want after cardiac surgery? And I say, really, no restrictions per se, but I didn't expect to get this picture. In fact, I showed this to one of my colleagues who said, well, which one is the patient? And I think that that's a pretty good sign. Obviously, this patient was feeling great and didn't have any active cardiac symptoms afterwards. So we've talked about how the normal heart works, how carcinoid affects the heart, recommendations for screening, opportunities to prevent carcinoid heart disease and treatment of carcinoid heart disease. And I'm just going to take a moment to talk about not the types of medications, but things to look out for with regard to new treatment options for carcinoid and how they may affect the heart. Now, I notice that there are lectures later on new treatment options for carcinoid tumors, but you'll note that these VEGF inhibitors, that there are some potential problems that can occur related to the heart. Sutent and Avastin, both used in patients with neuroendocrine tumors. And let's look at the problems that can occur from the cardiac standpoint. Hypertension or high blood pressure, stroke, cardiac coronary artery disease or myocardial infarction, and then cardiac dysfunction affecting actually the left side of the heart. 19% had decrease in left ventricular function. 8% had very significant symptoms related to that. But you'll note that the majority of individuals have improvement in heart function after therapy is discontinued. The other major player is the mTOR inhibitor, and you're going to hear more about these later on, everolimus or Afinitor, and problems that can occur from the cardiac standpoint, an increase in triglycerides, blood sugar increase, high blood pressure, and then clots in the veins with the potential for those traveling elsewhere. So in summary, take-home points for you today. Number one, carcinoid heart disease is a common complication of the carcinoid tumor. The diagnosis, really, the key to the diagnosis is an echocardiogram or a cardiac ultrasound. We need to refine the best timing for surgical intervention for you, those individuals who are affected. Advances in medical and surgical treatment have clearly improved survival. We know that an experienced multidisciplinary team is extremely important. And don't forget that some of the treatments that you may be getting could also cause some cardiovascular disease. So we want to be on the lookout for that. Thank you very much for your attention.